Ms. Trautwein, welcome. We're glad to have you back.
Thank you. Well, I'm here today representing over 20,000 employee benefit specialists nationally. And because of our experience with employer-sponsored coverage, we believe that any reform proposal, like many of our other panelists, should begin and center on employer-sponsored coverage. And I just want to reiterate the reasons for that. First of all, there are many different reasons why employer-sponsored coverage is advantage, but one of the most important that I want to make sure as we move forward with reform that we don't leave out is the significant financial contribution that employers make towards the cost of coverage for employees and their dependents. Without the funding provided through employers, many people who have coverage today would be uninsured. Now, a number of stakeholders in the health reform debate have articulated the belief that a public plan option is necessary in the marketplace and should be offered as an alternative to traditional private market employer-sponsored and individual health insurance coverage. I have to share, and you're probably not surprised, that we have a lot of concerns about such a program. Chief among them is the potential for an unlevel playing field and the difficulty that a public program would have competing on a level playing field with a private plan. We believe this would complicate and make the pooling process much more difficult for private insurance carriers and employer-sponsored plans. Another key issue is the cost impact a public plan option would have on all Americans due to cost shifting or the hidden tax imposed when providers of medical care are forced to adjust their prices they charge to private companies and employers in order to offset losses from government programs. A recent Milliman report estimated that over $1,700 of the annual premium for an average family of 4 is due to cost shifting alone. And if yet another public program is added, we're concerned that this amount would grow higher. Finally, we question the need for such a system in light of the insurance reforms that have been proposed by the insurance industry. With guaranteed issue, no pre-existing conditions, and no rating for health status, we fail to see the economic or social benefit of spending vast sums of money on a new government system that could be better utilized on the subsidies to help real people get the coverage they need. I want to stress our intent is not to discourage health reform itself. We firmly believe that the current system is unsustainable. There's no doubt that changes are needed, but we believe that we have to address those changes by addressing the true underlying problem with our existing program. And you mentioned that in your opening remarks, and that is the cost of care. We've identified some key healthcare cost containment mechanisms that should be included in a national comprehensive reform effort, and we've outlined these in the written statement, but in summary, I would just say that they include an emphasis on wellness and prevention, better use of evidence-based medicine, pay for performance, and ensuring interoperability of electronic medical records, and we believe that government and employer plans can lead in these efforts. As a part of overall health reform, we all realize that tax and other subsidies will be needed to make coverage available, and some immediate changes need to be made in our system simply to provide equity for individual market consumers with their counterparts in employer-sponsored plans. And I have detailed what those specific changes should be, and they would help self-employed people, which I know are a concern of this group as well. I'd like to stress, though, that this should not be done at the expense of those participating in employer-sponsored plans. We urge Congress not to tamper with the current tax exclusion and the employer deduction. Additional subsidies will also be needed for low-income individuals and, very importantly, for risk adjustment in plans. These are essential components of reform, and they'll be critical to its success. Reform discussions have also included increasing the role of employers in providing coverage, and although most larger and many small employers provide health insurance coverage, we believe a mandate to force employers to provide coverage to their employees, while well-intentioned, would have a negative impact on wages and job creation, and it would principally impact low-skilled employees because employers would be forced to cut jobs to control their skyrocketing labor costs. We just don't think that's what's needed in today's economy, and we believe that there are other roles that employers can play that may actually be more valuable than the role of being mandated to provide coverage. I'd like to close by briefly mentioning connectors. There's nothing inherently wrong with the pooling of groups of insurance purchasers. Insurers and employer plans do this all the time, but we have to remember that pooling alone doesn't impact costs enough to make the significant difference that all of us are looking for, because it doesn't impact the cost of care, which drives the cost of insurance. And if we expect a different result, We just can look to history where these purchasing arrangements have been tried before. And over a period of time, the pools actually end up being a more expensive option in the environment. And we are concerned that if a national connector or exchange doesn't allow for a competitive market outside of the connector, a situation could develop where there would be nothing left for people to go to if the pool imploded. And I see that my time is up, so I'll close for now, and I look forward to questions later.
Ms. Trautwein, thank you very much. We appreciate your testimony.
Well, it's a tough question because,
Yes, it is.
I think that's why I was first. I think that, we've been advocating for refundable tax credits and other similar subsidies for this very category of people for at least 12 years.
I know that it's a good idea. How would you finance the tax credits?
I hope that we will be able to finance some of it through savings in the system. I think we're also going to have to look at other creative ways.
I will tell you the Congressional Budget Office, and I think this is wise because it's conservative, gives us no credit for any projected future savings. So if we want to pass a law this year that covers the person who works in a convenience store or a gas station and her children, the CBO won't give us $1 worth of credit for some savings we might get 10 years from now. So what are the other creative ways?
Well, we've talked, and we have a proposal called Healthy Access. It's NAHU's proposal for health reform. And we've talked about the fact that it is difficult and that it's pretty fiscally irresponsible to advocate all these things without any way to pay for it.
Right.
Acknowledging the difficulty, we have looked at things that, the sin tax type of things, such as, a cigarette tax.
I will say that, of course, we raised the cigarette tax to pay for S-chip expansion, and it was controversial. We did it. I think we've kind of maxed that out for a while. Yeah. What else?
So I'm not sure that I have any more constructive. I wanted to talk.
The President, if I can, the President has two specific ideas. One is that the tax reductions for the top 5% would be repealed that are due to expire. He'd let them expire. Do you favor that?
Gee, I don't want to be one of these people that says we don't have a position on it, but I think we're going to have to look at creative things. That may be one of them.
Okay.
That may be one of them.
Fair enough.
And I think we're also
well, the other thing he's proposed is phasing out the subsidies to the insurance industry under the Medicare Advantage program. Do you favor that?
Did you say to phase out the Medicare Advantage program?
Yes, the subsidies to the insurance industries and the Medicare Advantage under Part D. Do you favor that?
Well, the feedback that I get from my members is that specifically certain types of Medicare Advantage programs really help people who are low to middle low income. So I'd be concerned if they all went away.
Okay.
Yes, there's actually, I'll point out two of them, but there are about a dozen of them that are really good. One of them is in Oregon. It's the Family Health Insurance Assistance Program. It's been around for many years. It's not really an overly bureaucratic system. It's simple subsidies to both employer-sponsored coverage for people who are low income that can't pay their share of the premiums there, as well as people that are in individual plans. And it's been quite successful and helped people get in coverage many times over the years, and it's run by just a couple of people in the Oregon government, so it's not heavily bureaucratic. It's very simply run. The other one that's newer is very, very interesting in Oklahoma, and it's actually increased its enrollment 200% in 2008, and it's what you call one of the 3-share programs. So the employee puts in part of the money, the employer puts in part, and then there's a fund in the state that funds the rest. And it's working very well. There is a good shared partnership, shared responsibility there. I think it's a great idea, and I think it could be replicated in other states if we had some encouragement to them to do so. Again, these programs just don't always have enough funding, but they've been able to figure out how to do some waivers and other things to keep that funding going.